different angle than I think a lot of the games that are used in this area are. So the first one, I guess first I want to talk about, though, at a higher level, the purpose behind these, because I think even within the scope of training, there's different ways to use games and simulations, and it's important to think about what you're trying to achieve. And so I'm going to talk about these projects in terms of how they attempt to build skills, build motivation, or give more of a high-level overview of systems and processes. So the first course is one that I worked on with the Union and the World Health Organization. It's about childhood tuberculosis for healthcare workers who are working in resource-constrained settings. And so tuberculosis is still the disease that kills the second most number of people, the infectious disease that kills the second most number of people in the world every year. It was number one until COVID-19 came along. And it's particularly hard to diagnose and treat in resource-constrained settings and with children because they don't necessarily have access to the tests that you might have access to in Canada or in Sweden, where I'm based. And even when you do have access to those tests, in children, they aren't reliable. So with this, we wanted to build sort of a simulated process of walking through what healthcare workers need to do in the field, which is very challenging and is not just based on easy answers. And so with this, we have the healthcare worker walk through the simulated process of diagnosing and treating a child. And so they ask questions to gather a history, they select different body parts, and as they do this, they gather additional notes. And then based on their notes, they have to decide which actions to take. And in some cases, they need to do it before they can order tests in this simulated environment, because again, we wanted to acknowledge the realities of doing this in real life are not perfect and are not simple. And then if they have diagnosed a child, they will come up with a treatment plan for them. And so I wanted to include this as an example of very much just straight skill building. So the healthcare workers who take this course are already bought into the idea that they want to find and diagnose children. They don't need to be convinced that this is important. And they don't necessarily need a lot of knowledge about the processes and systems about this, although we get into it a little bit with contact tracing and infectious diseases, but mostly this is about skills. And I think that online digital spaces, when you use simulation-like elements, are amazing for skill building in this way. But I also think this is not the only thing that games and simulations can do well. And so the next two examples focus more on motivation and then about these higher level processes and systems. And so this is another course that I worked on. This was with Transparency International Norway and the IFRC. And this course was about preventing corruption in humanitarian aid. And I would say that everyone who was going to take this course would already be bought into the idea that corruption is bad. We shouldn't participate in corruption. But at the same time, there's this struggle between wanting to prevent corruption and wanting to work quickly because you're trying to save lives. So it's very hard to say, oh, you just need to follow all the checklists and take lots of time and never participate in corruption, because there are trade-offs here. And so with this course, we wanted to sort of show some of the long-term impacts of corruption that people might not necessarily think of in a moment when they're faced with a decision. And then also show some of the sort of balance and trade-offs and ways that you can lessen the risk of corruption while still making sure you have an effective response. And so we started and ended this course with disaster simulations. And so in these disaster simulations, you are thrown into managing the high level sort of management of a disaster response. You have a series of scenarios from different parts of the response over a timeline. And then as you make choices, your choices affect these meters that are on the left. So things like overall corruption risk, beneficiaries' needs being met, community perception, and donor satisfaction. And with this, we wanted to make it very explicit that your decisions don't just affect one thing, that you have a lot of things that you need to keep in mind and that will have an impact both immediately after you make decisions, but then also longer term as well. So as you make decisions, you see the meters change. We tried to make sure all the choices that you have, again, aren't easy. We didn't want to say there's one right way to handle this or that there's a simple way to handle that, because that sort of makes light of the real difficult situations that people find themselves in. Another thing that we did is we wanted to acknowledge the time pressure of things like this. And so if you choose a choice that involves waiting, let's say you want to perform a needs analysis and you're like, yes, I would perform a month-long needs analysis. So if you choose to do that, you have to sit here and you watch this meter box sort of flash up red every day. You see what's happening to the beneficiaries' needs being met meter, to the community perception meter. And so you sort of feel some of these real world pressures of waiting and some of these factors on this overall system. So again, we wanted to acknowledge this and make sure that we were showing something that felt realistic and useful. At the end, you see your sort of overall progress. I think I was speeding through this because those are horrible results. So if you take the course, I hope you do much better than that. But at the same time, you'll never get to all green bars. Everything can't be perfect all the time. And we wanted to acknowledge that as well, that there are trade-offs in all of this. And so our purpose with this was some skill building, but I would say it was mostly around motivating people to see corruption as a problem with long-term impacts that affects a variety of different areas and not just maybe the immediate things you think of, but also motivate them that there are things they can do to reduce the chances of corruption without sort of sacrificing speed and effectiveness. And then also just learning about some of the processes and systems that they can use to prevent corruption. And the last course, I'm just going to speed through because I'm trying to go through 3 things in 10 minutes, which is very ambitious. But the last one that I want to talk about is a change management simulation that I worked on with Bull City Learning. And then it was Gates Foundation funded. And then we also had support from the World Health Organization. And this is a change management simulation, but specifically for immunization managers who are, again, working in resource constrained settings. So the things that are going to work in Canada or Sweden or the United States aren't necessarily going to work in these countries. And so we want to sort of acknowledge that there are challenges, but there's also, again, ways to sort of work around them and find wiggle rooms and creative solutions for some of them. And so for those of you who don't know, change management is the process of bringing people along for a change. And so if you wanted to implement a large scale change within an organization, you can change a process, you can tell people to do things differently, but they don't necessarily want to do that. And so this is convincing people that it is worthwhile to change and giving them the skills and knowledge that they need to make that change. And so the main dashboard that you're working with as you're going through this simulation are your change stakeholders. And you can choose to take a variety of actions. All of these actions open up additional actions after you take them. And then as you do that, you gather more information about your stakeholders. You start to impact their motivation and their abilities. You click in on any of the individual stakeholders, you have additional information and quotes about how they currently feel about the change. And then you can use all of this to plan out these next actions you're going to take as well and sort of plan your overall strategy for implementing this change. Your goal at the end is to reach 80% adoption at all of the locations, and you have to do this within a span of 78 weeks. And then at the end, you also sort of see a timeline of all the choices you make, and you get feedback on the order that you chose to take these actions in, and maybe there could have been things that you could have done sooner or later or differently to be more effective. And so I think, again, that this is not necessarily focused on skills. There are skills involved in it, but it is largely focused on thinking about the process, the very high level process of change management, thinking about the immunizations system as a whole and how your choices are going to affect it and affect your change stakeholders, and also motivating people that this is worthwhile to think about and think about getting right, because it is something that's not necessarily a regular part of the people's jobs who would be taking this course. And so they need to care enough to pull in the expertise and the team that they need to get this right. And so hopefully this helps to provide that motivation. Okay, so I have finished my run through the 3 of them. I will be here for the Q&A, so I can take any questions, but if you have questions later, feel free to reach out. I would be happy to geek out about learning and games at any time. So that's it for me.
Thank you, Amanda. That is fantastic and really interesting. It's always fun to hear about the cool projects that you're working on. I believe we have Gautam up next. So Gautam, without further ado, I think you can take it away.
Perfect. Can you see my slides there, Matthew? Thumbs up, yeah.
Yes, yeah, I can. Yeah, sorry.
Awesome. Great. So thanks again to Matt and Rex and the Connections North team for having me speak on this panel. As was mentioned, my name is Gautam Krishnaraj. I'm one of the 3 partner leads of Humanitarian Partners, not-for-profit organization that focuses on the design and delivery of humanitarian simulations and trainings, as well as other kind of consultancy services for the humanitarian sector. I myself have been working in the humanitarian training space for just over 7 years now, I think, working with a number of INGOs and academic institutions, so Canadian Red Cross, CARE International, Johns Hopkins Center for Humanitarian Health, and the one that I'm going to focus on today is our kind of longstanding partnership with Université Laval here in Quebec in Canada. And of course, both Matthew and I think some other members here are part of the UN Simulation Training Network. So kind of trying to draw on these joint experiences and today focus in on the training that we delivered last year for Université Laval, which was a shift from our kind of typical week-long in-person simulation training to our first virtual simulation-based exercise. So looking forward to jumping into that with you guys over the next 10 to 15. Before I do so, I want to definitely recognize that everything that I'm going to present today is the joint effort of a large team. So on the left there, we have our Humanitarian Partners core team, myself, Arndel, and Jean-Baptiste as the partner leads, Danica, Fred, and Miriam as part of the team, of our core team as well. And then we also drew on a number of subject matter experts as role players, and that'll come in later in the presentation as well, of that kind of importance of having high level actors and role players for these virtual sims in particular, as well as Professor Carlos Cano, who is the kind of university liaison and lead for the master's program within which this simulation was set. So yeah, just acknowledging that this is the efforts of many that I'll be presenting coming up. So I'm going to dive right into it. Recognizing that maybe the kind of contextual or storyline elements might not be the most important part, but more the tools and the structure that we use and how that differs from our in-person simulations. So typically we run a week-long program with the University of Laval. It's in-person training, blended learning approach, where they are in this Masters of International Development Management, International Development and Humanitarian Response Management. So they've been kind of versed in the standards and the different kind of subsectoral approaches. So we give them this kind of 3 days of lectures, brief them, kind of refresh all of these core skills and put them into the context of the training that they're going to be entering in the latter part of the week. And so around Thursday, they'll get a brief on the country context, on their NGO teams that they'll be representing, some of the roles, and then we dive into a 72-hour immersive simulation experience. So this was the same both in person and virtually. So it's around the clock from Thursday night through to Sunday night. And it kind of culminates in this large press call and kind of summation of the exercise that's been done. And we have these opportunities for networking and things like that. So trying to bring in as many of those in-person elements as possible, while also recognizing the tools that we have had available this year. So in the simulation, we typically have 30 to 40 students or participants. We break them out into different NGO groups. Some of those NGOs are represented above. And in the past, the students have been asked to take on a number of different roles. So whether that's some sort of medical capacity, whether a doctor, nurses, some sort of logistical, kind of technical logistical role. And what we wanted to do with the virtual sim was really look at every single element and reevaluate how it aligns with the needs of kind of humanitarians, international kind of expatriate humanitarians, and as well with the specific needs of these students. So recognizing that they're in an international development management program, and they don't have technical skills as a physician or an engineer or a water and sanitation expert would have. We wanted to reframe those roles and kind of give them training on what they're actually going to be doing should they continue working in this field. And so we broke it down into 4 different roles, all of which are profiles that any of the organizations above would probably hire for. The first being human resources and administration, the second humanitarian affairs officers, communications officers, and logistics officers, focusing on kind of supply chain management. And the core focus of this sim was really around kind of these different capacities that they would need to have. So that HR admin really focusing on management at a distance, with the humanitarian affairs officer bringing in and kind of synthesizing information from various different actors, again, working from a distance. Communications officer, very much the same thing. And so focusing on these skills that they will need to apply rather than, say, training them up in triage, which is incredibly important for them to understand as a concept and know what their role is in the kind of mass casualty incident if they are in the field, but less likely that they're ever going to be calling the shots during triage as someone with one of these backgrounds. So we really focused in on those specific skill sets for our training. And this next thing that we kind of reevaluated as we made this shift from in-person training to virtual training was the lines of communication. So in a kind of in-person simulation, you're able to just walk up to students. You can see where they are, see what they're doing. They're on the radios. Everything is kind of observable. You have a team of evaluators who are walking around the kind of the site. We needed to create that site except in virtual spaces, and we wanted to do that in a way that allowed our team and our team of evaluators to kind of move freely rather than being kind of asking permission from the participants to enter calls. Because when we set that kind of precedence, then that changes the dynamic of their interactions between the kind of observed and unobserved calls. And we wanted to make sure that that evaluation was as kind of true and genuine as possible, and that we were actually capturing how they were interacting with their fellow team members, with other teams, and with our kind of our roster of actors and role players and subject matter experts. So to do so, we used a kind of mix of different online resources platforms. And the reasoning behind this was, again, we're recognizing that this is very much like in the early stages of virtual training. We wanted to see what these different tools provided us and how they might interface together, recognizing that often organizations have their own platforms and their own mechanisms that they want to use and their own preferences. And so what is the strength of using Google Meets, of using Zoom, of using Slack? So we tried to see how those things fit together. And we had these kind of 3 main in-sim lines of communication. So within the teams, they had Slack channels, all within this kind of larger architecture, which all of the observers and our kind of exercise control team was able to pop in and out of to observe and evaluate. NGO to NGO, similarly, email, Zoom, and the Twitter world. And the Twitter world was very much what brought the sim to life, both the Zoom calls and the Twitter world, where we had a number of kind of accounts that were all following each other. It's where we disseminated news. We had access to some NGOs, some real world NGO media databases, which allowed us to kind of create content using video and photo footage that kind of brought it to life, that made it seem much more real, get that immersive element. And similarly, their NGO teams to the SimX world were the same kind of platforms. Then it was also important to kind of maintain that out of sim control. So if there were any real world emergencies, there was a channel for that came right to me as the director. We did use that. I mean, during our simulation, there was stabbing events in Quebec City, so we were still able to kind of ensure the kind of safety and security of all of our student participants, as well as mental health support. And we thought that this was important, particularly given the kind of complexity of the scenario and some of the different content that we were covering, and our inability to rely on those kind of gut instincts to see how people are handling the stress or handling these different things that they're being exposed to. And Nick Ford has been a mental health support through many of the in-person sims and was able to be available throughout the duration of the simulation. And we thought that that was quite important to carry forward. Our simulation, another goal that we had with this kind of pilot virtual sim was looking at these core humanitarian competencies and really thinking and trying to see how they translate over to a virtual space. One of the things that we were incredibly open to throughout this entire process with all elements of our simulation was that it could fail. it could be that virtual simulations are not the mechanism to train professional humanitarian workers. And so we were open to seeing which of these core competencies were effective or effectively evaluated, were observable, that we could design kind of training injects around, and which ones we couldn't. And the aim of doing that is that ultimately, if and when we return to in-person exercising, those trainings will be that much more streamlined and meaningful and intentional in the areas that we focus on, because we know that those are the things that need to be kind of observed and evaluated in an in-person setting. So we took this kind of 360 approach where there's pre, post, and peer assessments along the 13 core humanitarian competencies from the core humanitarian competency framework developed by the CHS Alliance. And then as well, we had a team of kind of expert evaluators who were moving through these different channels and communication platforms. And rather than producing a kind of numeric value or some sort of quantitative report, in a sense, because we want to avoid the situation where students are going to an NGO and saying, I'm 94% ready for the field. We wanted to focus more on strengths and kind of areas for improvement. So this is kind of the first bar chart kind of compares how they perceived their strengths and weaknesses in the different core competency areas to their peers. And then this radar chart below is based on the evaluators. And this kind of gives it more of a qualitative feel, and each student has a completely personalized report based on this and based on a number of qualitative comments collected from their peers and the evaluators. Through the sim, or just as a kind of piece of the storyline, we established this fictional Canadian International COVID Assistance Fund funding proposal. So it was a two-stage application, and this was their primary task through those 72 hours, was to submit the EOI, gather enough information from their field teams as well as headquarters, and submit an application or submit a bid to this central fund. Now, in addition to that central fund, through those 72 hours, we have these injects. And so one of the things with shifting to virtual sims was we needed to have much more kind of material. There's less on this kind of on the whim where you can just pull someone aside and say, I need this inject to happen right now, and give them all the information because you've got your XCon there and everyone's in XCon. We wanted them to have those supports. We also wanted to make sure that our simulation was still this kind of open world concept. So rather than having a strict kind of line of injects that they're all going to have to do, based on their performance, based on the challenges they've had, they might get any level of a inject narrative. And then you can see, again, based on the core humanitarian competencies that they've either that they're either lacking or that they've already demonstrated, we can pick injects to make sure that they're getting this kind of holistic assessment. And then on the side there, we can also see which kind of resources we need from our team and which roles we anticipate the NGO teams will choose to kind of mobilize in response to these injects. And then this was another kind of resource that we developed, which was our character card. So this kind of, again, allows for more information to be standardized, that people are prepared and know how these roles fit into the different injects up top in that kind of tag, as well as the different communication channels that they'll be using. And so this is functionally what our sim looked like. It was during the kind of COVID-19 lockdown. So we all were tested and had kind of all the paperwork and were in isolation prior to that 72 hours. And then we kind of locked down together to deliver the sim. And the reason behind that was we realized that that's just one extra line of communication that could complicate things. So rather than having to interact with our team that was across the country, as well as the students who were international, we thought it would be better if our small team was together in one place. So you can see different elements that we've got here, that kind of live content production. So whether that's voice clips, kind of dispatches from the field, short videos. Fred was there kind of developing that. We see Arndell, the kind of operations lead, making sure things are going smoothly. We had WhatsApp, Zoom, Slack going. We can see Matt, who was our actor extraordinaire with his green screen. So we're kind of coordinating efforts there. We've got our kind of COVID-19 precautions as much as possible. And then, of course, recognizing the social nature of these things. We recognize that these trainings are often an opportunity for humanitarians to share learnings and to have that kind of social interaction in a non-field-based setting. So supporting those things through kind of sending food and all of those was a nice social element, again, bringing it to life, making it feel like it is this community that's being built up. And so I know I'm coming up towards the end of my time, or have passed it already, but the kind of key lessons that I want to share were that virtual simulations can indeed replicate most, but not all aspects of face-to-face sims. Again, talking about that the challenges of immersion and applying those stressors. It's much easier to cut the power, to be pounding on the doors in the middle of the night on a compound than it is to stress someone out who's at home having dinner with their family, talking about a fictional simulation. Definitely certain core competencies were easier to assess. We're going to work on a report to disseminate around these kind of core competencies in particular. Multi-platform integration works well, but we're looking to streamline our tools. And then most importantly, virtual simulations definitely require a more experienced and involved exercise control team and roster. And that was a kind of important element of our learnings this year. And that was my timer going off in the background, so I'll open it. I guess we're going to do questions after everyone's spoken, but hopefully that gives you guys a good sense of our Laval SimX this past year. Thank you.
And thank you, Gautam. That was fantastic, and I love that picture of all the mayhem in the house. It was sad to be on the other side of the world and or the country, I guess, and not being right there with you guys. So our next speaker is James Maltby of Save the Children. And without further ado, James, I think you can take it away.
Thank you so much, Matt. Yeah, the mayhem in that house. My goodness, I would love to be a mayhem in the house with my team at the moment in the UK. We're all stuck working completely remotely. That looks fantastic, though. And what two amazing speakers to follow. My goodness. So hopefully I can keep the energy up because there's been some absolutely fantastic ideas that has been shared so far. Just to reintroduce myself very quickly, I'm James Maltby. I'm the digital learning lead at Save the Children UK. For those who are not aware of Save the Children, we're a very large humanitarian organisation, 29 member organisations across the whole world, over 24,000 staff. So we really do work with all elements of the humanitarian sector. But my particular team is actually based in something called the Humanitarian Leadership Academy. We are based within Save the Children UK, but we're very much designed to be cross-movement and cross-sector as well. So we do as much work as we do with Save the Children as we do with other humanitarian organisations. And our big mandate is about offering learning, digital and innovation support to humanitarians and humanitarian organisations across the entire world. And my team, the digital learning team within that, really concentrates on that digital learning production, design and development side of things, which you can imagine due to COVID-19 and lockdown has really increased. There's a huge demand as we're all now moving from face-to-face training delivery to online-based delivery. And in terms of a little bit of a personal vision for myself, I really truly believe that technology can really empower and expand the reach of our training programs, which ultimately will enable us to support more vulnerable adults and children worldwide. And at the moment, our platforms and resources currently reach approximately 300,000 humanitarians, but we have a really grand, big, audacious goal that in 5 years' time, we really do want to reach over 1 million humanitarians because of our cross-sector nature. So I'm really, really excited about what the next 5 years is going to hold. Just before I come back to the question that's been posed for the discussion, I just want to take a little bit of a step upwards a little bit and actually start by thinking about what is the main challenge, the learning challenge that really gaming, serious gaming, online simulations may hope to solve. And for me and for my team, we're really thinking about the situation and practical skills nature of training. It's about finding a model for remotely training humanitarians to respond to complex situations where practical experience is essential. And that really came out from the last two speakers about the idea of situational and practical skills. How do we develop soft skills? How do we develop situational skills? And some of the big trends in that has been e-learning courses which develop more of a scenario-based activity like Amanda talked about, online simulations like Gutham just talked about, do a lot of work with Matt on community-based simulations and co-design, really, really strong trends. And a final trend that I really want to concentrate on this moment is serious gaming. actually the idea of designing games at a sophisticated level, but for a serious activity. And in this case, it is training humanitarians to respond to emergencies. So what I'd like to concentrate on now is a particular case study looking at this particular problem, which is called In 90 Days. So this is a serious game we've been developing with Preloaded, which is a major BAFTA award-winning games company. If no one's heard of BAFTA, it's the British equivalent of the Oscars, and there's a games award, and Preloaded won a game for educational. So we've really partnered with someone who really knows what they're talking about with games, really looking to trying to create a narrative-driven game to help train our field managers to effectively lead humanitarians in emergencies. And one of the reasons we took this approach is we realized that humanitarians aren't game designers. We really don't know much about game design. We know the subject matter. And for us, we really wanted to experiment with, if we partnered with a major game design company, bring their creative skills, their design skills with our subject matter experts, what could we actually produce? And just to let you know, this is actually the world premiere of this app, because the app's not been launched yet. It's going to be launched in about a month's time. So you're the very first group of people who are going to hear about it. So there you go, a little bit of a premiere there for this conference. The idea of 90 days is you're managing the first 3 months of a humanitarian disaster. It's seen that the first 3 months is what the key time for getting on top of disaster relief and for field managers to develop strategies in order to have there be a successful response in the future. That was a really key aspect of this. It's based on the idea of authentic disaster scenarios with embedded complex events, but presented as narratives. And I'll show you some examples of what that means in just one moment. And this is actually written by previous responders. So this has been designed with responders who have worked in the field, worked in Haiti, for example. Our manager actually was a Haiti field manager. He brought a lot of his experience, and other local NGOs as well who've been involved in the creation of this. And we've actually done this as multilingual. So from the very start, we've designed this as a multilingual app in Arabic, English, French, and Spanish, hopefully at launch, although the French might come a little bit later.
James,
yes,
this is Matt. I just wanted to interrupt you briefly. I'm sorry. We're just seeing your first slide, I think.
I'm really sorry. I did wonder actually when people start mentioning. That's all right. That's all right. I'm really sorry. It's often
we don't want to miss it. Especially now that you're getting into the
exactly. Don't worry too much, everyone. You haven't missed too much just yet. Yeah, no, bless you.
There we are.
Please do interrupt if there's any problems. But I always say, if a learning technologies has problems, no one else has to worry, do you, about technical stuff? It's absolutely fine. So what I'll do is I'll just go back one. I mean, I pretty much just read out what the slides were up to this point. But I think if I just go back a few, sorry, there we go. I'm just going to zoom through these very quickly, just so you get a little bit of an understanding what they look like. But really, you're absolutely right. The absolutely best slide to start with is this one, where I introduce the actual,
there we are,
what it looked like. So there we go. So if I just move on and just repeat what I just said, that this is about managing the first 3 months of a humanitarian disaster. So these are the most important 3 months for developing the field response. It's an authentic disaster scenario with complex events that's been co-designed with other responders. Here we go. And it's multilingual support as well. Now moving on, we're up to the speed now. So the core mechanic of the game is based on the trade-off dilemma. So players must continually make strategic decisions on how to prioritize quality, speed, and cost. So at each scenario point, at each event point, there is this key mechanic at the moment to decide between them. And depending on what they decide, will then designate the flow of the rest of the game. The game economy is based on the idea of how many days left to respond to local events, and the whole game is adaptive and replayable because it's procedural. So depending on the events you do, the actual game mechanic behind it will procedurally generate the events that could happen in a random. So it's not a case of being deterministic about them being correct and a wrong answer. There is actually a certain degree of ambiguity depending on the results. You may at the end make completely different outcomes with it. So that's adding to that replayability, because the key learning aspect for us is that replayability there. So here we go. Here is a couple of screenshots. I'm glad we got that fixed before I showed that. So this is the way the game looks. So it's divided up at the moment into 3 main scenarios. So we're planning to add more scenarios. There was a climate migration, rural conflict, and a pandemic scenario. And each of these scenarios have been designed completely independently. So each of them have different events within them, a lot of rich content within them, lots of different examples of what might happen. And each of them have their own mechanic set for balancing set for that particular scenario. So this is an example of the pandemic. It's designed as a narrative, so a lot of the information comes through these little text briefs, and this allows us to portray a lot of information, but also allows us to have that multilingual support, because this is easier for us to translate and create a very, very rich environment for the gamer. The map here screen designates the different events that are happening, and this is randomized as it goes through, and the player is then choosing the events here that they want to take at any particular point in their response. Here we go. And we try to add these really quite fantastic graphics we added into it to make it a little bit more engaging, to give it a little bit of visualizations as we're going along. And as I said before, the core mechanic is this idea of a trade-off dilemma. So there is these three ideas: quality, knowledge, and timeliness. And players have to choose two of these. And depending on the two they give, it will be a different response that they will be giving in that particular scenario. And this has happened at every single different point, these ideas. So in this case, we're going with keep the briefing short. And this is the response at this particular point that the driver gives when we keep it short. So different playthroughs, you can try different scenarios, but because it's very procedural, very adaptive, you can get completely different experiences each time you play it. And there we go, this example of 2 days there being reduced for this particular activity type. So the economy is based on this idea of days. So different things you have to respond to will take different times. So it can be up to about 15 days, I've seen in some of my playthroughs. And based on that, different key events will happen, like the two examples here on the screen, where these are emergencies that happen that, because of your decisions, may actually take you more time. So each point you've got this risk of potentially being other events happening, which reduce your time even further, right the way down to 0 days left. And when it's 0 days left, that's the end of it. And there is a debriefing explaining how the scenario has played out, what things you did, and understanding why the consequences happened because of your decisions at the very end of it. And that's in 90 days. So as I said, that we're planning to launch this in the next month on the Android store, but there's plans to launch it for iOS later to responders. But we're really excited about this as a model, potentially for other humanitarian organizations, and an example of learning that could be used across the whole sector. So far, it's difficult for us to talk about impact because we haven't actually launched it yet with our direct responders. But in terms of, from a process point of view, some of the things we've learned so far is that I don't think we would have been able to do the complex game design mechanics without that game design input from an external company. They were really fundamental to us, our decisions to do that balancing exercise, to use that procedural generated nature of the scenarios. That was very much their vision and something they really, really brought to this project. What I think we've lost, and I think maybe projects like Amanda's talked about and Matt's talked about, is perhaps that more contextualization about working with local communities and getting holistic responses with the games and being a little bit more specific with some of those. But we are hoping, because this is a pilot, that in future, if we were to do this again, we would be able to be a little bit more contextualized, be a little bit quicker with the process, and really try and make it a little bit more specific to future disasters we talk about. Fantastic. So apologies for that slight technical problem at the beginning, but like I say, you saw the good bits, and I'm not worried. I'm glad you saw the right bits.